Broadcasting from the financial capital of the world, this is NBRFM, New York City.
Welcome back to the program. My next guest is the owner of Beyond Basic Physical Therapy based in New York City. Please welcome to the show, Amy Stein. Hello, Amy.
Hi, thanks for having me on the show.
No problem. How are you today?
I'm great. A little chilly in New York City, but good.
Yeah, it's that time of year, but we'll get through it soon. It'll be April, May, June, July. We'll be good. So, Amy, tell us a little bit about what you do, Beyond Basic Physical Therapy.
Sure. So we specialize in, it's called functional manual therapy. So basically manual therapy techniques to really try to get the athlete and the everyday exerciser or non-exerciser back to the gym, back to their sport safely. We also specialize in pelvic health, which it is an orthopedic condition, but it involves specifically the pelvic floor. And people just don't realize exactly what that means. We basically see symptoms of bladder, bowel, and sexual dysfunction in the pelvic area, including abdominal pelvic pain in men, women, and children. So not just everyone kind of thinks pelvic health, they think of women and they think of incontinence and pregnancy and postpartum. But we see 40% males in our office and about 15-20% of kiddos with bowel or bladder issues. So it's much more prevalent than anyone thinks. It's actually 1 in 4 women suffer from pelvic health issues, and it's about 1 in 5 or 1 in 6 men. So it's quite prevalent. They say that it's just as prevalent as low back pain or back pain. Interesting.
Okay. All right. So how do you help?
So the functional manual therapy that I mentioned before, we use a lot of those techniques, both external and internal. Yes, we do internal work in a very safe and private environment, and we basically work on releasing the muscles and releasing the tension and the tissues. So I explain it to patients, specifically, again, for the pelvic health, that it's similar to having like neck pain or neck spasm, that muscle is just really taut, it's really tight, and it's causing issues in the pelvic region. Yes, we treat neck issues too, but with regard to pelvic health, it basically, because of where the muscles are located, which is basically the bottom of the pelvis, they surround the genital, bladder, rectal area, you end up with bladder, bowel, and sexual dysfunction, or some do. Some end up with some symptoms of one area and symptoms of another. And we just work on releasing those muscles. We re-educate the patients on how to relax those muscles. What we find in our kiddos is not as much of the pelvic pain, but more abdominal pain, because they end up in a holding pattern and they don't want to go to the bathroom, or they're scared to go to the bathroom, or they had a bad experience. So that then is something we see in adults too, where they're holding that area. It's like they're holding their tension in their pelvis. So what we do as physical therapists is we re-educate the muscles with them. We give home programs for them to do at home so that they feel confident and safe, and so that they can get involved in their rehab. And we just continue with the manual therapy until they get some relief. We do incorporate some nutrition and behavioral modifications. And then I've been around the company's been around since 2003, and we've had a lot of success in pelvic health as well as with orthopedic conditions too.
Okay. So tell me a little bit more about your background. Why do you do this?
That's a great question. When I was in PT school, I had a friend I was always interested in orthopedics and sports. I'm a skier, snowboarder. I don't do it so much anymore in New York City, rock climb, and just all sports in general. And I really liked the idea of PT and helping people and being more one-on-one with a patient. I like the idea of medical school, but at the same time, I really like the one-on-one idea of really spending time with the patient and getting to know them. And then with regard to pelvic health, I actually had a friend that had a hysterectomy and ended up in severe pelvic pain, bladder frequency urgency, bowel frequency urgency, pain, constipation, irritable bowel symptoms, as well as sexual dysfunction. And she just was beside herself. Physicians, they ruled out a urinary tract infection, they ruled out the back, and she was a close friend of mine at the time, and I was trying to help her, like, what could this be? And I went to my professors and I said, they ruled out the back, they ruled out a urinary tract infection, any other organic issues, but she's still in severe debilitating pain. She was in bed half the time because of the pain. And it ended up, the professors didn't know that much. This is over 20 years ago. They didn't know that much about pelvic health. And they said, well, look up, open up your books and look it up. So I looked it up and I became interested in the subject. And then just over the last 20 plus years, I've been really looking into how to help these patients. The whole field of pelvic health has evolved significantly over the last 20, 30 years. So it's been impressive. We still have a far way to go with regard to educating healthcare providers on what exactly pelvic floor physical therapy is, as well as patients in the community, because they really feel, a lot of these patients feel helpless. Our men come to us, they have prostatitis but no infection, and they've been on antibiotics over and over again and nothing's helping, and they just wonder what they could do. They feel helpless. Our females the same. They come to us, they've been having these bowel issues or bladder issues for so long, pain in the area, and they just don't know what to do. So we fortunately, as long as everything else is ruled out, there's no infection, there's no organic condition going on, then we can help them significantly, and okay. They're very grateful.
So how can people contact you for more information?
Sure. BeyondBasicsPhysicalTherapy.com is our website. I also wrote a book, Heal Pelvic Pain. That's on Amazon or on the website Heal Pelvic Pain, and a DVD. So that gives like a home program for patients. And then our phone number is 212-354-2622 if you're in the New York area. And we're happy to help.
All right, excellent. Amy Stein, thank you for coming on the show today. Beyond Basic Physical Therapy, New York City.
Thank you so much. Thanks for having me.